going to talk about the pelvis and leg. The pelvis has two main parts, and those two parts are each called os coxae. You need to be able to tell left from right, os coxae. So when you look at one of these, this is the middle part. And if you were to push the middle part into the table and see this hole, this ridge is going to stick up on the side. So this is the middle. If you were to lay down on the table, you can see that this ridge sticks up on the lateral aspect. This is going to be the left os coxae. We're going to explore this more in lab. This cavity that sits the femur to make up your hip joint is the acetabulum. The obturator foramen is a large hole in each one of these os coxae. The obturator foramen allows for nerves and blood vessels to get down to the legs. If you think about obturator, kind of sounds like operator, you wouldn't be able to operate your legs without nerves and blood vessels getting down to them. So obturator foramen. In the back, you have the sacrum, and then the coccyx, and then you have this arch of the pelvis, and that's the greater sciatic notch. What nerves do you think go past this sciatic notch? Sciatic nerve. Each os coxae has three major regions. The ilium, which is the part that you actually set your hands on when you put your hands on your hips. The ischium, which is your butt bone, that's the part that you sit on. And the pubis, which protects the pubic region and supports the external genitalia. The pubic symphysis is going to hold the two os coxae together. The ischial tuberosity is a rough bump for muscle attachment. The iliac crest is talking about the region that sticks up at the top of each ilium. Again, when you put your hands on your hips, you're actually putting your hands on your iliac crests. Your femur is going to attach in here in the acetabulum, and that's what helps form the leg. This femur has a head, and you need to be able to tell left from right femur. So the smooth surface that your patella is going to sit on is going to face toward the front of the body. And this head has to face inward because it's going to attach into your pelvis. So this is going to be the right femur here. And this is another picture of the right femur from the back side. So the head is at the top, the neck is right underneath the head. The greater trochanter is best seen from the back side. It's this large bump. And the lesser trochanter is the smaller bump. The greater trochanter and lesser trochanter are going to help really anchor that femur into your pelvis. Then you have medial and lateral condyles, which are at the bottom. An intercondylar notch is in between the condyles. The patellar surface is the smooth flat surface for your patella or your kneecap to sit on. And then this is what your patella looks like. You don't need to know the different parts of the patella, you just need to know that the patella is the kneecap and what it looks like. So moving down from the femur, we have the tibia. And the tibia supports all of the weight in the body. The front part of the tibia is this rough surface known as the tibial tuberosity, and that serves as a major point of muscle attachment, and that's going to help form the knee joint. The medial malleolus, if you ever feel the inside of your ankle, it has that bump, that's the medial malleolus. So when we look at the tibia, it's this middle bump here. Going back to a real bone of the tibia, or real picture, it's this bump right here. Medial and lateral condyles of the tibia are highlighted. And then we go to the fibula. The fibula is the smaller of the two bones in the leg, and this one is on the lateral side of the lower leg. The head is at the top, while the lateral malleolus of the fibula is at the bottom, and it's at the lateral aspect of the leg. So if you were to feel the outside of your ankle, you have another bump on the outside of your ankle, and that's what that is. Now when we get into the tarsals, metatarsals, and phalanges, there's a few tarsal bones that you have to know their specific name of. So all of these bones in the ankle here are all tarsal bones. But one that you do need to know the specific name for is this bone here, and that's the talus. The talus is what your tibia is going to sit on in order to rotate your ankle or move your ankle in its hinge joint. Another one of the tarsal bones that you need to know the specific name for is the calcaneus. The calcaneus is the heel bone. And then the rest of those we'll just call tarsal bones. And then here's the name of the other tarsal bones, but remember you only need to know the ones that I just mentioned. So you need to know talus, calcaneus, and the rest you can just call tarsals. The metatarsals go through the sole of the foot, and then the phalanges, similar to the fingers, that's where the toes are going to actually separate.